In this video, we'll look at how to manage an unsafe swallow and the importance of posture and positioning when supporting someone to eat and drink. By the end of this session, you'll be able to identify how to reduce risks for people with an unsafe swallow, sometimes called dysphagia, the importance of positioning and posture, the importance of providing the right support with eating and drinking, and to be aware of other professionals that can help. Videos 2 and 3 have looked at what happens when food goes down the wrong way and how to spot the signs that this is happening. This video will look at things that you can do to reduce the risk of an unsafe swallow or difficulties in eating, drinking and swallowing. It's very important to support the person's posture when they eat and drink. Always ensure they're sat as upright as possible and are sat in appropriate stable seating when eating and drinking. Whether the person eats sitting on a dining chair or in a wheelchair, the important thing is that they're supported to sit upright. Remember, the person's head, shoulders and hips should be in a line. If a person is very poorly and given food or drink in bed, they must be supported to sit up in bed, either by using pillows or, if they have an automatic bed, setting the position so they can sit upright. Even people who are fed by a peg should be sat upright whilst they're eating or drinking directly into their stomach. This will be looked at in more detail in video 6. Check the person's care plan and find out if they have any physiotherapy advice regarding their positioning when eating and drinking. Poor positioning or posture can increase the risk of swallowing difficulties. Ensure that the person has the support that they need when they're eating and drinking. Check their care plan and find out if they already have advice from a speech and language therapist. If they do, ensure that this advice is always followed. Modified diets and thickened drinks will be looked at in video 5. As discussed in video 3, encourage and support the person to keep their mouth clean. This includes teeth brushing twice a day and ensuring that the person's mouth is clear of food pieces after eating and drinking. Prompt the person you're supporting to eat and drink slowly, have small mouthful, and chew their food thoroughly before swallowing. Prompting the person to put their knife and fork down on the table between mouthfuls can also help with this. Reduce distractions when eating and drinking. This might include switching off the TV, removing unnecessary items from the table, or avoiding making conversation while the person is eating and drinking. Avoid eating and drinking when the person is tired or sleepy. Instead, try to have bigger meals when the person is most alert. If the person is having difficulty swallowing medications, contact their GP or pharmacy to find out if their medications can be prescribed in another form, such as liquid. Some people might also throat clear and cough when they're not eating and drinking. This could be a sign that the person is struggling to manage their saliva or is experiencing reflux. As discussed in video 2 and 3, it's very important that the person with suspected swallowing difficulties sees their GP. The GP will refer them to a speech and language therapist if they have swallowing difficulties. Speech and language therapists support people with difficulties in eating, drinking and swallowing. Their role is to collect a detailed history about the person and their swallowing difficulties. Speech and language therapists will observe the person eating and drinking, usually over a meal time, and where possible, complete a detailed examination of the muscles that the person uses to eat, drink and swallow. Speech and language therapists may sometimes refer people for examinations of their swallowing. For example, a video fluoroscopy, which is when someone has an X-ray while they are eating and drinking. Speech and language therapists will provide specialist advice about how to help the person to eat and drink and swallow safely. This might include modifying the texture of the person's food and drink, identifying what eating and drinking equipment that person should use, and advice on positioning and environment when eating and drinking. A dietitian can offer advice on nutrition if the person has lost weight, They will provide advice if the person takes their food via a peg. They can also give advice on food fortification and nutritional supplements. Physiotherapists can offer advice about positioning and postural care. If a person has difficulty sitting upright or has an altered body shape due to physical disability such as cerebral palsy, they can assess for specialist seating. Remember, the less a person moves around, the more at risk they are of fluid settling on their lungs and leading to infections. Physiotherapists can offer advice on chest exercises and postural drainage. All these professionals can also offer advice and specialist training to you in your role to help improve your knowledge and skills and help you provide the best support to a person with an unsafe swallow. It's very important to always follow the advice of other health professionals in reducing the risks associated with an unsafe swallow. You should now be able to identify how to reduce the risks for people with an unsafe swallow, sometimes called dysphagia, the importance of positioning and posture, how to provide the right support with eating and drinking, and other professionals that can help.